All this week on 7 Eyewitness News at 6 a.m. and 6 p.m., you'll be hearing directly from the leaders of 6 county health departments on what it's been like to be in the front seat of this COVID-19 crisis. 7 Eyewitness News reporter Olivia Proya brought them together for a virtual roundtable to discuss the pandemic, the challenges, and the future. Tonight, we're taking you in depth on the lessons learned from the ongoing vaccine rollout.
Public health departments have had pandemic response plans for decades.
If our plans that we submit every year had been followed, I believe the rollout would have gone a lot smoother than it has.
Unfortunately, the state went a different path on the initial rollout, which I think resulted in a very slow and cumbersome process. It was very confusing for our residents, not much less us.
Supply has also been an issue.
Unfortunately, the supply has not been able to meet the demand so far. So we're still limited by the supply. However, I mean, that's a global issue.
However, we are being allocated a much greater number of vaccines than we were in the beginning. And we're starting to remove quite a few of those residents that we have on our waiting list off our waiting list due to the larger amount of vaccines that are being allocated to our area.
As allotments increase, some Western New York health directors say they wish the state would give them more doses to redistribute themselves.
And part of that is knowing who is where in our communities and what strategies we need to use locally. And that really was overlooked by the state. And we're still struggling with that.
We know our communities better than they do. So I think all of us on this call, we can identify areas that are underserved already in our county and would like to have the resources to be able to go there and provide that vaccine.
At one time, it was said that there was a failure of the public health system in New York State, and that's absolutely false. There's a failure to use the public health system in New York State.
You really get a sense that they want more control over the distribution. Olivia, did they say how they do that, if they had that control?
Yeah, Ashley, they want to be able to distribute those doses to doctors, hospital systems, and more community groups, in addition to holding vaccine clinics themselves. This way, they can target the communities that are either vaccine hesitant or lack access to the vaccine. They say they know those populations much better than the state.
Fascinating conversation. Thank you, Olivia. You can look for Olivia's reports from her wide-ranging roundtable with the people in charge of their county's vaccine rollout every day this week on 7 Eyewitness News at 6 a.m. and 6 p.m. Also later tonight and on Wednesday and Friday at 8 p.m. you can watch the entire unedited discussion on our streaming app 7+. If you don't yet have our app, we have download information for every connected TV. You're going to want to get it. All the information is at wkbw.com/apps.